you ever experienced such severe pain that you didn't think you were going to be able to make it through the day? I believe this is what the type of pain that Dr. Elliott is speaking about in his speech, The Mystery of Chronic Pain. In his speech, Dr. Crane identified himself as one who treats patients with chronic pain and states pain can become a disease. The focus of the speech is to inform the audience that pain can become a disease. He is very clear about this fact. Today I would like to review with you the pros and cons of Dr. Crane's speech. To begin the speech, Dr. Crane identified himself as a pediatrician, an anesthesiologist, and an academic teacher. But he made a joke about this by saying that he makes a living by putting kids to sleep. It was an attention getter by making a joke, but he also was verifying his credentials that he was the person that could speak about this subject. Another thing that he did was he performed a hands-on demonstration of what it feels like to have chronic pain. The example was if a feather were to touch the skin on you or I, we know what that would feel like. But on a patient that has chronic pain, it would feel more like a blowtorch hitting the skin. He also stated that 10% of the time, patients that are in pain, it can become chronic, which makes it a disease. He gave statistics. He also gave a demonstration. Great attention getters. Another thing that he did was showed a face of one of his patients on the screen. He said that she was a patient, but he also named her as Chandler. This made it more personable that she was a person and not just a patient. Then he showed pictures of her arms, the one with the chronic pain, and it was quite obvious why she was having chronic pain. Dr. Crane went further and then compared the nervous system to the hardwiring of a house. Pain in the hand goes up the arm to the brain, just like if you flip the light switch on at your house, pain in the hand goes to the brain or to the junction box in the house. I thought that was a great analogy, and he also gave some visuals for that. The speech had many positive aspects. 1, the speaker identified that he was qualified to speak. 2, he used demonstration. 3, he used visual aids. 4, he had an analogy of the electrical versus the nervous. 5, he was enthusiastic throughout the whole thing. He started with a joke and he ended with a joke. A few negative aspects is one of his PowerPoint pictures was a description of the brain and how the brain reacts with pain. The wording was very small, so it was hard to see. He also spoke a little bit faster during this time, and he used some words that he did not define the meaning of. The delivery techniques, overall, his delivery techniques, beginning with a joke, his demonstration, his examples of pictures, the analogy, and then ending with a joke, were all very effective tools to use while giving a speech. I learned that by providing a variety of visual aids, physical demonstration versus pictures, they both can be effectively utilized. I also learned that when providing visual aids, the words need to be large enough for the audience to see, vocabulary needs to be simple, and to speak slower when you have a large amount of information to be absorbed. In summary, Dr. Crane was enthusiastic throughout the speech and kept the audience attention by diversifying his visual aids. Dr. Crane's speech of The Mystery of Chronic Pain was informative via demonstration.